Sa panahon ngayon, ano ang alagang Pilipino? Ito ay alagang hindi makasarili. Alagang laging gumagawa ng paraan. Alagang nagkakaisa para sa bawat isa. Alagang handa sa anumang hamon. Alagang ramdam kahit saan ka man. Alagang maaasahan. Alagang nagbibigay ng solusyon at mga ngiti. Alagang busog sa pagmamahal. Yan ang alagang Pilipino. Alagang may husay at malasakit. Alagang nagbabayanihan. Nakikiisa ang UNILAB sa lahat ng Pilipinong walang sawang nagbibigay ng alaga para sa kalusugan ng bayan. Alagang tunay, alagang Pilipino.
Breast cancer. The very words are daunting. A sickness that is not as easy to treat as a common cold or a cough. It will certainly entail a bigger expense. The threat it poses is against life itself. In treating the disease, it is important to prescribe medicines that will improve the quality of life of the patient, giving her hope that springs from giving her a sense of empowerment against the sickness, a feeling of being on top of breast cancer. In treating breast cancer, the choice must be trusted products of quality, the best in healthcare, yet affordable. Trusted quality healthcare products that are affordable. A comprehensive breast cancer portfolio to effectively address the different stages of treatment for your patients. Docetaxel Docetax and doxorubicin Rubicin to treat the disease with medicines that are a mainstay in the regimen for breast cancer treatment and management. Filgrastim Neosite and zoledronic acid Osteomet to overcome the complications and side effects and continue treatment for a better quality of life. And anastrozole anazole to prolong and sustain life by ensuring a disease and progression-free journey. Choose to be on top in the battle against breast cancer. Choose Onco's Breast Cancer Management Solutions.
Dear God, thank you for the opportunity to meet together. Please help us to come together to make this institution reflect your kingdom. Breathe life into our ideas and decisions. Help us build a team that has love and respect at its heart. Give us the strength to continue working for your kingdom in this time of pandemic. Lord, come give us the inspiration to be the best we can be. May we be a shining example of your goodness and truth within, wherever we are. Inspire our thoughts, discussions, and ideas, and continue to remind us that all that we do here today, all that we accomplish, is for the pursuit of truth for the greater glory of you. We ask these things in your name. Amen.
Bayang magiliw, perlas ng silanganan, alam ng puso, sa dibdib mo'y buhay. Lupang hinirang, duyan ka ng magiting, sa manlulupit, di ka pasisingil, sa dagat at bundok, sa simoy at sa langit mong baghaw, may nilang ang tula at awit sa paglayang minamahal. Ang kisap ng watawat mo'y tagumpay na nagdidinig, ang bituin at araw niya kailan pa may
In November 13, 1969, the Philippine Society of Medical Oncology was born. Its charter members belonged to the first batch of U.S.-trained medical oncologists that returned to the Philippines. The handful of specialists organized themselves to pioneer the practice of medical oncology in the Philippines, following its vision as a scientific and professional organization of competent and caring oncologists committed to the advancement of the science and the ethical and holistic practice of medical oncology. Over the years and spanning more than 3 decades of history, its members exponentially grew. Including members from training institutions all over the country. Reaching out not only to its members, beyond its conventions, training programs, scientific meetings, and symposia. PSMO extended its services and activities to benefit the public. Cancer fair, outreach programs, and tree planting activities. PSMO is an active component society of the Philippine College of Physicians and of the Philippine Medical Association. As a society, PSMO continues to provide opportunities for continuing medical education to develop its members professionally, ensuring the standard of excellence of the science and practice of oncology, fostering the development and advancement of oncology, as well as securing the welfare and interests of its members. The Philippine Society of Medical Oncology by far is in the best position to take on the challenges of the years to come and to lead its members into this era of great changes.
Yes, good afternoon, magandang hapon, maayong hapon ka natong tanan. Mga breast friends nato diha nga nagtan-aw sa Facebook page. Maayong hapon ka natong. Magandang hapon po at alam niyo po itong taon na ito sa ating Pink Cancer Chat 2021 is para po itong part 2 ng ginawa po natin last year. Ang topic po natin this year is healing from the pandemic. And katulad po ng aming inaasahan almost every year, whether virtual man po o kaya yung actual na nagkikita tayo sa ating Pink Cancer Chat, sana po marami po tayong matutunan and whatever learnings that we may get today, even the past year, sana po ma-share natin sa mga kakilala natin na pwedeng may cancer o wala man pong cancer, i-share po natin lahat po ng ating matututunan. And of course, talking about sharing sa mga nanonood dyan sa Facebook page ng Rotary Club Cebu, Fuente, maayong hapon. At sa ICanServe page po natin, magandang hapon po sa inyong lahat. And of course, i-share po natin ang live. At huwag po natin kalimutan na kahit tapos na po ang ating FB Live sa hapon na ito, pwede po nating i-review, i-replay ang ating Facebook Live ngayong hapon na ito at maibahagi po natin ang lahat po ng ating mga learnings again sa lahat ng ating mga kakilala. Maayong hapon! So wag na po nating patagalin at para po officially i-welcome tayong lahat. Makakasama natin ang President ng Philippine Society of Medical Oncology, ladies and gentlemen, family and friends, Dr. Buenaventura Bill Ramos Jr. Maayong hapon, Dr. Bill.
Good day, everyone. It's a Pink Cancer Chat again. And the Philippine Society of Medical Oncology has held this annually for several years now, together with our friends from the different organizations sharing similar advocacy. ICanServe Foundation, Philippine College of Surgeons, especially the Central Eastern Visayas chapter, Philippine Radiation Oncology Society, Rotary Club of Cebu, Fuente, and Onco UNILAB, together with our invited speakers, entertainers, and our host or MC, who agreed to join and support this annual celebration. And of course, you for being here, for always supporting our activities and being open and willing to learn more. We do this for various reasons, mainly for information campaigns to spread awareness about health, breast cancer, and the ways to prevent, detect, and treat breast cancer, and improve the quality of life of our patients, survivors, and caregivers. We also intend to offer some entertainment to lighten our moments together, to inspire, and to motivate. Our event also serves as a venue for us to get together as we unite with one vision, dream, and a prayer of a life free from cancer. Or perhaps a life with cancer but free of suffering. Welcome, everyone. Let's all learn, enjoy, and have fun.
Thank you so much, Dr. Bill. That's my brother from another mother. Dr. Bill, mayong hapon. And of course, mga higala, at this point, I would like to share with you a breast friend of mine, a breast friend of ours, who's been inspiring all of us for years now. And I'm truly grateful that she entrusted me to host the past Pink Cancer Chats, and I am forever thankful. Ladies and gentlemen, ICanServe Cebu Coordinator and the past District Governor of Rotary International District 3860, Ms. Mary Ann Alcordo Solomon. Ate Mean, maayong hapon.
Thank you very much, best friend Erwin. You have always been our best friend MC for the past years. I think it's been more than five years to be exact. Sayang hindi lang tayo face to face. Nasa theater sana tayo ngayon. Before anything, my heart is filled with gratitude as I'd like to thank our partners through the years. Who says that doctors aren't your friends? They are. And that's why this is happening, our second virtual Pink Cancer Chat. So I'd like to thank the Philippine Society of Medical Oncologists, the Philippine College of Surgeons, and Philippine College of General Surgeons, Central Eastern Visayas Chapter, the Philippine Radiation Oncology Society, Onco UNILAB, and of course, I wear two hats. ICanServe Cebu Chapter and the Rotary Club of Cebu Fuente. I'd like to begin with one of the area of focus in Rotary, and that is disease prevention. So our awareness for early detection of breast cancer is really one of the focus that we're doing in Rotary to inform people. ICanServe, on the other hand, also shouts out the mantra of early detection saves lives. And this is to empower us of information of what we have and what we can do. And with our frequent webinars, there's never ending knowledge. We empower ourselves because we want to keep families whole. We want you to keep your mothers, your sisters, your aunts, your grandmothers, and even your girlfriends. We want to save lives. So early detection is the best prevention. Early detection saves lives. Early detection is the cure. So this October, it's celebrated worldwide as Breast Cancer Awareness Month. Let's turn pink, and happy Pink October. Back to you, Erwin.
Thank you, Ate Mean. Ugmayong hapon diha ninyo, Ate Mean. So ngayon, mga kaibigan, wag na po nating patagalin. Alam ko maraming mga katanungan tayo ngayong panahon po ng pandemic kung gaano ba kaimportante ang COVID-19 vaccine sa mga kapamilya, mga kapuso, mga kapatid nating may cancer. Para kanino po ba ang COVID-19 vaccine? kailan natin dapat ito i-administer at kung bakit. At para pag-usapan po niyan, makakausap po natin at makakasama po natin ng isang medical oncologist at PSMO Vice President. Ladies and gentlemen, join me, put your hands together for Dr. Arnold John Uson.
Hello, Erwin. Thank you. Sorry for the technical glitches.
Hi, Doc.
Mayong hapon. Thank you for that introduction. No? I'd like to thank, of course, the organizer in the PSMO. And then I'd like to greet all our friends, our breast friends, no, our cancer survivors, not only breast cancer survivors, but all over the survivors of cancer, the big C. So welcome for today's afternoon. I am privileged to talk to you about one thing that we actually should know. Okay, I'll share the slides. I'm sorry. Can you see my slides now, Erwin?
Yes. Clear na
Okay.
clear po, Doc.
Okay, thank you. Okay, good afternoon, everyone. I know the hindi lang ito Bisaya, but also all over the Philippines. I would like to welcome you for today's afternoon pink chat. Okay, today I'm tasked to talk to you about COVID-19 vaccines in cancer. For whom should it be given? What type of vaccine should be given? When will it be given? And why? Okay. So I'm sure you have lots of questions in mind. Okay, these are the disclaimers. These are presented based on the current evidence from different guidelines. The PSMO local guidelines, which is the Philippine Society of Medical Oncology, the National Cancer Cooperative Network, the ESMO, and the ASCO guidelines, no? Comprehensive network. Now, our objective for today is actually to discuss COVID-19 vaccine in cancer patients and survivors. Whom should the vaccine be given? What type of COVID-19 vaccine should you take or should be given to you? And what are the potential adverse events? When should the vaccine be given? During treatment, after treatment? Why should a cancer patient be given COVID-19 vaccine? Okay, let us go back in time for a short. No, you know that COVID-19 is a disease. It is caused by a virus. That outbreak started in Wuhan, China, and through the months to almost a year now, we have already the first community transmission in the country in March of 2020. That's more than a year ago, and the first case here in Cebu was in March 2020. Currently in the Philippines, as of September 24, we have around 2,453,328 cases. This is unprecedented, and about 175 active cases. And at that time, we have about 37,400 deaths. Now, you know very well that there were spikes. There were about there is what we call surges, no? Lately, we have surges in March, June or July this year, where there is an increased number of infection. Why is this? Because there are still a lot of patients who are not immune with this disease. Currently, because of these surges, there is what we call certain concerns. SARS-CoV-2 variants. We have which are actually the variants that are quite aggressive, probably more transmissible, because this virus what we call proliferate in the body of persons, and they are transmitted from one another. And the more they are transmitted, the more the high chance of mutations on these viruses. So this also impact our chance of healing from the pandemic. This is what our hope is. As our cancer chat today, is what we call healing from the pandemic. It is also the same theme we have in our PSMO annual convention. We want to heal from this pandemic. We want to end this pandemic. We want to be together. We don't, as Mayan says, hope, why are we here? We are more on virtual. We hope that we go back to the pink chat where we can hug each other, when we can greet each other personally. So therefore, we want to end this pandemic. And our hope is actually to increase the immune system so that we will be immune and we will not be able to be infected by this virus. And this is one, COVID-19 vaccine. Safety, efficacy, and hesitancy among all of us. Some of us may have hesitancy to have this one. And there are even concerns of anti-vaxxers. They do proliferate in the social media, telling us not to take this vaccine. So what is vaccine? Okay. Now, there are two types of immunity. We want to have immunity so that we will not have be having the complications of this virus. We have natural infection when we are about to have the COVID-19, and the other one is immunization with vaccine. Because when we are infected by the virus, that virus will stimulate our immune system to have antibody against it. And when we have antibody protection, then we cannot be succumb to this disease. So natural immunity, and the other was immunization to protect us from getting exposed again to the same pathogen or to the same virus, and so that our system will be able to know this virus already. Now, how does COVID infection do? You know, this is the COVID infection. This is a natural infection. Don't be intimidated by the slides. You just see there that the virus going inside the cell and that produce antibody between ourselves. And this virus then cause our, you see there, the B cells producing antibody so that it will try to kill this virus. This is the same thing in the vaccine. The vaccine is actually will have a component of the virus without the pathogenicity of virus. It looks like the virus so that we produce antibody for it, but it does not have the potential for the disease. Di tayo magkakasakit doon sa to that vaccine. So we will produce antibody. Dalawa yung antibody. Yung isang antibody po is yung immediate antibody, which is coming from the B cell, but meron din tayong T cell. Yung ating Diyos marunong po. Binigyan po tayo ng dalawang immune system that the B cell is immediate. Pagdating ng mga kalaban, papatayin ka agad ng antibody. Yung isang T cell po, yun yung nagme-memorize para matatandaan niya. So that pag bumalik na naman another virus, makakaproduce pa rin siya ng antibody para bang natatandaan niya yung virus na yon. And this is what we call the memory T cells. Medyo complicated, pero yun po ang ginagawa ng vaccine. Yun na yun din ang nagagawa ng isang infection. No? Marami na po tayong type of this vaccine. Makita mo po dyan, maraming kulay po yan. Basta meron pong Sanofi, Novavax, nakita nyo may Pfizer, Moderna dito, may AstraZeneca, Sinovac. Iba-iba po silang type. Meron po, basta ang importante po, minimimik nila o ginagaya nila yung itsura ng virus para po yung katawan natin mag-produce ng antibody doon. Pero hindi po tayo magkakasakit ng COVID-19. Yun lang po yung ginagawa nila. Artificial, parang artificial looking, no? na virus. Yun po yung gusto. Bakit po tayo kailangan mag-vaccinate sa buo, regardless whether you are a cancer patient or not? The aim of vaccination is to cure during pandemic, is to eradicate this disease. Gusto po natin mag-prevent ng progression to more serious illnesses. Kung magkasakit man tayo, hindi po tayo mamamatay doon sa virus. Tsaka magkakaroon po tayo ng herd immunity. Ano po yung herd immunity? Ito po yung mga kung nakikita nyo po yung red na yan, ito po yung tao na may sakit. Pag pinasa niya po or nagkaroon siya ng ubo at itong paligid niya magkakaroon ng mga infeksyon. Yon, nagiging red. So pasa-pasa yan, pasa-load. Pero iba po kung meron pong immunization. Pag immunized na po, nakita po yun ninyo itsura nung naka-brown or color gold na tao, sorry for this, yan po yung immunized na person. Pag yung red na tao na infected, pagka umubo siya at yung naubuhan niya po at may immune antigen na doon sa virus, hindi yun ho magkakasakit at hindi rin niya kayang mapasa man lang to the other areas kasi hindi na magge-generate. Alam po natin na ang virus pag nandun po sa katawan ng tao, sinasabi ko sa mga pasyente ko, para yan mga alien. Nagpo-produce sila doon, nag-mutate sila at pasa ng pasa. So kailangan po natin na lahat po tayo magkaroon ng immunity to this disease. Cancer and COVID infection. Ngayon, bago po natin malaman kung ano po yung kung sino bibigyan, bakit po kailangan pati sa cancer patients? Hindi ho ba delikado sa cancer patients na nagtitreat? So why do we need to have cancer, COVID-19? Marami pong, para malaman po natin na ang why do we vaccinate, alam po natin pag nagkaroon po ng infection ang COVID-19, ang isang pasyente, meron po marami dyan na o-hospitalize. Marami po dyan at nagde-delay po yung cancer treatment. Kung dapat nga mag-chemo ngayon, sasabihin na de-delay tuloy kasi hindi agad-agad magamot. At mas mataas po ang death rate sa may cancer patients. Ito po ay napag-alaman nila na higher risk of COVID-19 related death, almost 2.3 higher times 2 higher ang mortality ng patients na may cancer na magka-COVID. Kung magko-COVID, mas malaking chance na magkakaroon ng komplikasyon sa taong walang cancer. Ito rin po ang nalaman nila doon sa mga may sakit na those patients have high hospitalization, mas matagal, mas nagkakaroon ng complication, mas malaking chance na mamatay sa COVID. Marami pong mga studies and these are the few thousands. You see there, 73 million po yan ng pasyente doon sa Amerika at tinignan nila yung mga pasyente na merong cancer. And nakita po nila yung exposed, those who patients with cancer have about a higher chance of increasing complications than those who do not have. And these are people who with cancer have high chance of death. Makita po ninyo na dito rin sa study, nalaman nila those who have recent cancer, doon po na cancer na diagnosed within 6 months, pag nagka-COVID, malaki pong chance na magkaroon ng komplikasyon sa COVID. And those patients with leukemia, Hodgkin's lymphoma, lung cancers are also highest among cancer death with COVID-19. Pag nakita po ninyo dito, ang hospitalization rate, yung sa kanan po nito, 24%, lang sa mga patient na walang cancer, pero kung na may cancer po, 47.7, almost 50% hospitalization rate, and then almost 15% mortality. Doon po walang cancer at na nag-COVID, 5.26 lang ang mortality. Dahil dito, masama po ang COVID-19 sa mga may cancer patients, particularly those who have been recently diagnosed and those undergoing treatment. Isa po dito is the mechanism of immunosuppression. Dahil po immunocompromised, dahil po sa primary malignancy, meron din malnutrition dahil hindi gustong kumain at nangangayayat, and because of treatment related. And because of this, they are immunocompromised, they have less chances of battling the virus. And those leukemia and Hodgkin's lymphoma. Marami rin pong other associated factors dahil po nagbabara doon po sa may mga intestinal sakit sa may colon cancer, or doon sa mga head and neck cancer na nagkakaroon ng obstruction, pwede po dahil doon na i-immunocompromise ang pasyente. Pag tinignan nyo dito, meron pong immune dysfunction because of the malnutrition, dahil hindi mahilig hindi nakakakain. Because of this interplay, malaki po ang chance na mag-complicate sa COVID-19 infection. And because of this, mas lalo pong kailangan na magkaroon ng protection. Those who are undergoing chemo and radiation are also immunocompromised. Dahil dito, they said that this vaccine should be given on cancer patients because of this interplay of factors. Now, kaya lahat po ng mga expert sa cancer doon po sa Amerika at dito sa Pilipinas impose or tell us that it is best for have the vaccination for cancer patients, particularly undergoing treatment, to have a protection against COVID. Now, COVID-19 vaccine, kung sakali, kailan po dapat ibibigay? Ito po at dalawa po, may inactivated and live attenuated. So far po, wala naman pong live attenuated vaccine sa COVID vaccines. Lahat po ay inactivated or what we call messenger RNA. So preferably at least 2 weeks before or after chemotherapy. Or kung sakasakali man, kung meron man malaki ang chance na magkaroon ng COVID, mas importante po ma-vaccinate anytime. Okay? Now, again, inactivated vaccines should be given at least 2 weeks before chemo or after chemo. Or those patients already ongoing chemo, kailangan po natin magtanong sa ating oncologist, most particularly dahil po yung vaccination, yung chemo naman every 3 weeks, in between po doon ay pwede man maibigay. Pero preferably 2 weeks interval in between. Tatanungin natin bakit, no? Now, when to vaccinate in the surgery. Pag i-operahan po ang pasyente, kailan po dapat siya i-vaccinate? Sinabi po dito, wala namang contraindication para lang po di ma-postpone yung inyong procedure kasi minsan may side effect ng fever, konti ang vaccination. Siguro maigi na ibigay yon at least 1 week before the surgery or 1 week after surgery. Pero kung sakaling kailangan naman i-operahan, unahin na po yung operation. Now, these are this PSMO position when to give it. Again, in all po, ang importante is the protection against COVID-19. That's why in our statement, if there is a high number of COVID infections sa lugar po natin at yung mga kamag-anak na nagkakaroon na ng COVID, hindi po natin antayin. Kailangan na po natin magpa-vaccinate. Mag-a-adjust na lang po yung inyong oncologist. Okay? Vaccination on availability. But of course, if it is not something that is immediate, pwede po mabigyan ng distansya at least 1 to 2 weeks interval between cycles of chemo. Okay, sino po ang bibigyan at ano pong klaseng vaccine? For whom and for what? Ito po ang position statement ng Philippine Society of Medical Oncology. Patients with cancer, all cancer patients should receive any of the COVID-19 vaccine available in the market that has been approved by our local and international FDA. There is as long as there is no contraindication to that vaccine. Ang contraindication lang po ay yung may mga allergy or hypersensitivity to the component of the vaccine. Those and because we believe that vaccination can still reduce the morbidity and mortality or pag magkakasakit at mamamatay sa COVID-19 kung ma-reduce kung meron po tayong COVID-19 vaccination. Okay? So, common adverse event, ito po yung local redness and swelling. pwede po magkaroon ng axillary lymph node. Kaya mas maigi po kung sakali man nag-vaccine kayo at meron kayong naramdaman na kulani or lymph node, sabihin nyo rin po sa inyong doktor na nagkaroon po kayo ng COVID vaccination kasi baka malito siya, akala niya nagkaroon na naman ng progression ng disease. Antayin lang po after 1 to 2 weeks, nawawala naman yung kulani or yung lusay sa Bisaya. Meron pong fatigue, headache, muscle chills, and fever and nausea, yung pangsusuka o mga chills, pero ito po are mild. Usually, kaya po ng isang paracetamol or biogesic, which is the UNILAB. No? Pero pong analgesics and antipyretics or pwede po ibigay at nawawala naman po yung mga adverse event. Meron pong extreme cases na nagkakaroon ng thrombocytopenia, bumababa yung platelet, thrombotic event, pero napag-alam po nila these events are extremely rare, less than about 0.001%. Okay? So COVID-19 vaccine will not lead to an infection. Hindi po tayo magkakaroon ng infection sa COVID-19 sa vaccines. Hindi po totoo pag nag-fever ka, nagkaroon ka na ng COVID. Hindi po. Na minsan meron pong nangyayaring ganon, siguro naman nagkataon lang na na-vaccinate siya, pero sa totoo nagkaroon na siya ng COVID infection. Okay? And it does not cause false positivity to RT-PCR. Hindi po ibig sabihin na vaccine ka, magkakaroon ka ng RT-PCR positive. Now, the key points, mechanism of immunosuppression, lahat po na may cancer, malnourished, malignancy, and those undergoing treatment should have a vaccination. And the goal of a vaccination is to eradicate the disease, halt the progression of the COVID, and of course for herd immunity, and so that it will also protect us from death and complications of COVID-19. COVID-19. Now, the recommended vaccines, aside from COVID-19 for cancer patients, are influenza vaccine, pneumococcal vaccine are important aside from the others, which is meningococcemia or HPV in some groups. But the influenza and pneumococcal vaccine, it is a must. And COVID-19 is recommended for all cancer patients with no preference to what type of COVID vaccine. And the adverse event are mild and easily be treated, and pain on injection, which are actually outweighs the benefit of cancer treatment. Thank you. Erwin?
Yes, thank you so much, Dr. Uson. And in relation to that na diniscuss po ni Dr. Uson, meron po tayong isang video na mapapanood gawa po ng PSMO. It's a COVID-related video, and at the same time, maraming nagtatanong sa iyo kung ano po ba ang ICanServe. Kaya ito pong dalawang videos ay atin pong mapapanood.
Erwin,
Yes,
okay. Let us tell also the audience that the question, I'm sure may mga question po tayo. Meron po tayong question and answer after the 3 lectures. So
That's
don't
right.
worry. So
Ayan.
reserve your question later on. Okay,
Tama po
see
yun.
you.
Dr. Uson, meron po tayong 203 participants dito sa Zoom natin, and I'm sure
Okay.
maraming nanonood sa ating mga FB pages na shinare natin. Kaya pwede nyo pong i-comment yung mga tanong nyo po at mamaya meron po tayong open forum na gagawin. Right, Dr. Uson?
Yes, okay. Thank you. I hope
Thank you po.
you heard me clear. Thank you.
Maraming salamat, Dr. Uson.
Erwin.
And at this point, yung binanggit ko nga pong video ay inyo na pong mapapanood. So let us all watch this.
Ang mga pasyenteng nagkasakit sa COVID-19 nagkadaghan gihapon. Mao nga ang mga taong taas ang riskong magsakit niini sama sa mga pasyenteng na cancer. Kinahanglan makabatu og saktong proteksyon.
Busa, kami sa Philippine Society of Medical Oncology o mga espesyalista sa cancer, nag-auhag sa tanang pasyente at tunay cancer na magpapakuna batok sa COVID-19.
Dili angay mahadlok magpabakuna. Ang bakuna ay makamino sa symptoms sa COVID-19. Kay kung matakdan ta, kini pwede makamatay.
Sa mga pasyente magsugod pala ng chemotherapy, ang primero o unang bakuna ihatag 2 ka semana sa dili pa magsugod ang pagpanampan.
Sa mga pasyenteng kamulo pa ng chemotherapy, mamahimong mahatag ang bakuna samtang entras ng ulat pa sa susunod na chemotherapy cycle. Arong musaka ang resistensya sa pasyente batok sa virus, mamahimong mahatag ang bakuna sa panahon na nisaka na o nakabawi na ang blood count sa pasyente. Sagad sa o 2 ka semana, ikan sa pag-therapy o dili pa naatay ang sunod na chemotherapy cycle.
Siyenteng dool na nga mahuman ilang buong pulso sa chemotherapy. Ihatag ang bakuna mga 2 ka semana ibigan sa katapusang cycle sa chemotherapy. Sa mga pasyenteng adunay lymphoma o leukemia, magdawat og tambal anti-CD20 sama sa rituximab targeted therapy, ihatag ang unang bakuna mga 2 ka semana sa dili pasukan ng tambal. Pero sa mga nakasuod na o pagtambal, mahimong makahuwat sa pagbakuna 3 ka o 5 ka buwan kumikan sa katapusang cycle sa treatment. Sa mga pasyenteng nagawat immunotherapy sama sa pembrolizumab o atezolizumab, walay gitumbok na schedule. Pero mas maayo mahatag ang immunotherapy mga 2 o 3 ka adlaw human sa pagpabakuna. Mahimong ihatag ang bakuna sa sunod sa 1 o 2 ka semana humikan sa operasyon. Dili siya ituman sa maong semana sa pag-opera. Kay mahimong na ay mga komplikasyon sama sa hilanan o posibleng musapaw sa epekto sa bakuna at di naman gani. Sa atong mga cancer survivors na wala na nagdawat ng active treatment sama sa chemotherapy, katong mga pasyente nagpilar na ng kapitas sa cancer o katong mga nag-surveillance follow-up na lamang, mahimong magpapakuna sa pinakadaling panahon kung sa ang vaccine na maanaan. Ang Philippine Society of Medical Oncology or PSMO, walay gipiling klase or brand na bakuna sa mga pasyente, dili angay magpili kay kining tanan nga bakuna epektibo, luwas, o aprobado sa FDA.
Ang kasagaran side effect mao ang pagpamuypoy o pagsakit sa parte sa lawas ng injection, manakit sa mga dutahan, ilanat o labad sa ulo. Dili tanan makasinati kaning nga side effects ug kung naman mawala ra pod sulod sa usa or 2 ka adlaw.
Importante kaayo ni ang pagpapakuna batok sa COVID-19. Mudugang kani og proteksyon tabi na sa mga pasyenteng naay cancer. Pero buot pud namo ipasabot nga dili ra ang pagpapakuna ang makasalbar nato at aning pandemya. Ang pagtuman sa minimum health standards sama sa pagsuot sa face mask, face shield, physical distancing kung kanunay kapatugan sa kamot ang apil hapon.
In our 20 years of service, we've come to know these things to be true. Early detection is best. It's your right to know exactly what's wrong. You deserve the chance to right what is wrong. No one has to go it alone. You need a navigator and a roadmap to find the solutions for you. Hope is stronger than fear. Education is more powerful than ignorance. There is strength in partnering with like-minded groups. Local laws are binding. Working all over the country with different people and different mindsets builds strength, allays fear, corrects misinformation, and overcomes helplessness. As co-founders of the Cancer Coalition Philippines, we helped pass the cancer law. So the fight against cancer is every Filipino's fight. After 20 years, we've come to know these things to be true. The army of love, hope, knowledge, and power is always stronger than breast cancer. We are the ICanServe Foundation, 20 years strong.
There you have it, ladies and gentlemen. And at this point po, we will see and hear a very beautiful song written by Dr. Bill Ramos Jr. And of course with music from Serge Michael and the special arrangement made by Phoenix Tarongoy. Mga kaibigan, hindi po ito hugot song ha. It's a truly inspiring song, not just for our cancer patients, not just for our cancer survivors, but para po sa ating lahat na may mga pinagdadaanan sa buhay. Walang iiyak, but let's be inspired. And of course, this song is made to life by a very talented lady at kasama ko po siya sa UpLive na streaming app. Nag-promote pa ako. Isa po siyang tawag ng tanghalan Visayas contender in 2017, Cebu Pop Music Festival Grand Champion in 2018, Huning Sugbuanon Grand Champion in 2020, Cebu City Fire Office Himig Handog Laban sa Sunog Grand Champion in 2021 at isa po siyang vocal coach and a freelance event performer. Ladies and gentlemen, Miss Nessie Diaz.
Gifts flowed freely. There were ups and downs, but things were all that easy. My world was good, though sometimes tiring. Took most of my time from morning till evening. Yet I went through it, day in and day out, resigned to the humdrum of everyday life. You vanquished every want and everything. A monster you seem meant to destroy my dreams. I chose to face you with courage and faith, with one I needed action, with the other I found strength. With open arms of total surrender, I was led and I obeyed. Then things and events slowly fell into place. At the end of the day, I was exhausted, comforted by the faith that I had gained. Then you came along without a warning, took me by surprise without even knowing. I said, how could you come at this perfect time, when my career is at its peak? Now it's at stake. You vanquished every want and everything. A monster you seem meant to destroy my dreams. Then I chose to face you with courage courage and faith. With one I needed action, with the other I found strength. With open arms of total surrender, I was led and I obeyed. The things and events slowly fell into place. With this new vision, I see clearly now. Things happen for me, never against me. So I am healed, I am free now. Surrender to it, that's how it should be. Then I chose to face you with courage and faith. With one I needed action, with the other I found strength. With open arms of total surrender, I was led and I obeyed. Then things and events slowly fell into place. With one I needed action, with the other I found strength. With open arms of total surrender, I was led and I obeyed. Then things and events slowly fell into place. I was led and I obeyed. Then things and events slowly fell into
Wow, napakagandang kanta. And Dr. Bill, pengi akong kopya nun para ma-jam ko rin sa aking mga streaming na racket ngayong panahon na rin. Dr. Bill, kamusta po? And mga kaibigan, makakasama po muli natin ngayon si Dr. Bill para pag-usapan po natin ang breast cancer treatment ngayong panahon ng pandemic. Ano po ba yung mga teleconsult versus face-to-face na nauuso ngayon, di ba? Na sa Facebook, nagkukonsulta ang mga pasyente sa kanilang mga respective doctors. Ano bang pinagkaiba nun sa immediate versus delayed consult? So again, ladies and gentlemen, family and friends, ay isang napakagaling na medical oncologist sa buong mundo. At ang ating PSMO President. Once again, Dr. Buenaventura Ramos Jr. Good afternoon once again, Dr. Bill.
Thank you and good day, everyone. COVID-19 is an infectious disease caused by a new strain of coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. On January 30, 2020, the Philippine Department of Health reported the first case of COVID-19 in the country with a 38-year-old female Chinese national. On March 7 of the same year, the first local transmission of COVID-19 was confirmed. Since then, the Philippines, together with the rest of the world, has faced the challenges of this pandemic. Cancer patients are especially vulnerable to develop severe COVID-19 disease. Providing cancer care in times of COVID-19 poses a unique challenge to clinicians, patients, and families. These significant challenges during the pandemic have been weighing treatment benefits against the potential transmission risk of COVID to patients and healthcare providers, and administering treatment in healthcare settings where resources and capacity are strained. Publication of guidelines by several organizations facilitated the implementation of practical, evidence-based decisions. Breast cancer is the leading cause of cancer in the Philippines and comprises a considerable percentage of oncologic hospital admissions. Its treatment is complex, and outcomes are essentially based on timing. Given the current situation, the management of breast cancer is facing unique challenges. Hence, we have to modify old guidelines and adopt new protocols to lessen exposure risk and preserve resources without compromising the overall well-being of these patients. The guidelines that I'll be presenting were based on the Philippine Society of Medical Oncology, or PSMO, consensus recommendations for the management of breast cancer in the COVID-19 era. This guideline primarily localizes to the Philippine setting the recommendations by the European Society of Medical Oncology, or ESMO, as published in the ESMO Management and Treatment Adapted Recommendations in the COVID-19 era, Breast Cancer. For the surgical management, recommendations primarily came from the local guidelines published by the Philippine Society of Breast Surgeons in collaboration with the Philippine Society of General Surgeons last May 2020. In general, how should breast cancer patients be prioritized during the COVID-19 pandemic? The tiered approach of ESMO for cancer patients during the COVID-19 pandemic is designed across 3 levels of priorities. High priority would be when the patient's condition is immediately life-threatening, clinically unstable, or the magnitude of benefit qualifies the intervention as high priority, like when there is significant overall survival gain and or substantial improvement in quality of life. Medium priority would be when the patient's situation is non-critical, but delay beyond 6 weeks could potentially impact the overall outcome, and or the magnitude of benefit qualifies for intermediate priority. Low priority is when the patient's condition is stable enough that services can be delayed for the duration of the pandemic, and the intervention is non-priority based on the magnitude of benefit, like when there is no survival gain with no change, no reduced quality of life. With the discretion of the attending physician, patients can be prioritized into high, medium, and low priority for outpatient visits. High priority would be those with post-operative unstable conditions like hematoma or infection, breast cancer diagnosis during pregnancy, patients with suspected or recently established diagnosis of invasive breast cancer, patients in the active phase of treatment, patients with serious adverse events from treatment, and patients with development of new lesions or symptoms upon cancer surveillance. Medium priority would be post-operative visits in patients with no complications and diagnosed cancer patients at high risk of relapse during cancer surveillance. Low priority would be follow-up of patients without breast cancer but at high risk of breast cancer development like BRCA mutation carriers and patients in between negative cancer screening schedules. Now for diagnosis and staging. Among patients presenting with a breast mass, which should be prioritized for a biopsy? Those with breast masses highly suspicious for malignancy or who have already undergone imaging with highly suspicious findings for malignancy like BI-RADS 4 or 5 on mammography should be promptly referred for tissue diagnosis, while biopsies for lower suspicion lesions like BI-RADS 3 may be postponed. However, if there is a need to delay a biopsy, like perhaps if the patient is still for RT-PCR testing or awaiting breast imaging results, keep this within 6 to 8 weeks. Core needle biopsy is recommended as the initial biopsy procedure for diagnosis, and testing for estrogen receptor, progesterone receptor, and HER2 should be requested on all patients confirmed to have invasive cancer and ERPR for patients confirmed to have non-invasive cancer like DCIS. Initial metastatic workup in early-stage invasive breast cancer can be delayed, but not beyond 6 weeks. Among patients diagnosed with metastatic breast cancer, should routine restaging imaging tests be done? Patients without signs or symptoms of tumor progression may defer routine restaging scans. Now, let's go to treatment. Still for early and locally advanced breast cancer. First, for surgery. Should surgery be done without postponement for patients diagnosed with early or locally advanced breast cancer? Primary surgery of low-risk early breast cancer can be safely postponed for up to 12 weeks, but preferably within 6 to 8 weeks for low priority, guided by molecular profiling, if available, and experts' opinions. If aggressive tumor biology is present in histopathology, neoadjuvant chemotherapy may be considered before the surgery. For luminal-like breast cancers or the hormone receptor-positive tumors, using appropriate preoperative endocrine treatment can be an option. So which cases should be considered a priority for surgery among patients with early and locally advanced breast cancer? Cases that should be done as soon as possible include neoadjuvant patients finishing treatment, clinical stage T2 or N1, ER/PR positive, HER2 negative tumors, triple negative or HER2 positive patients, discordant biopsies likely to be malignant, excision of malignant recurrence, incision and drainage of breast abscess, evacuation of a hematoma, revision of an ischemic mastectomy flap, revascularization or revision of an autologous tissue flap. Please take note that reconstruction should not be done urgently and should be done either after the pandemic or once the condition stabilizes. Breast-conserving surgery is encouraged whenever possible. Defer definitive mastectomy and or reconstruction until after the COVID-19 pandemic resolves or the condition stabilizes, provided that radiation oncology services are available. Patients who have completed neoadjuvant chemotherapy or those progressing during such treatments should receive curative surgery with no postponement. However, if the surgery scheduling cannot be facilitated, adding another cycle of neoadjuvant therapy in patients responding well to the treatment may be considered. Surgical management is needed within 4 to 8 weeks among patients who completed neoadjuvant chemotherapy and opted to have upfront surgery rather than further systemic therapy, and patients with progressive disease during neoadjuvant chemotherapy or hormonal therapy. Now, how about radiotherapy? Adjuvant radiotherapy for high-risk patients like inflammatory breast cancer or node-positive or high-risk biology should be scheduled as high priority. Adjuvant radiotherapy for low-risk, intermediate-risk patients with breast cancer like aged less than 65 years old and stage 1 to 2 luminal cancer, ER positive, regardless of nodal status or positive margins, are considered medium priority for radiation therapy. What is the acceptable time for delay in initiating radiation after chemotherapy? The initiation of radiation therapy with an interval longer than 8 weeks was associated with increase in local recurrence rates at 5 years. When systemic chemotherapy is being given, radiation may be delayed to complete the systemic chemotherapy since there is no impact on overall survival when chemotherapy is administered first. Adjuvant radiation therapy should be administered within 7 months of surgery. Given the current pandemic setting and with the community quarantine in effect, for patients who cannot travel or have no access to a radiation oncology facility and are ER/PR positive, hormonal therapy can be offered while postponing RT. For patients and are HER2 positive, trastuzumab therapy can be offered while postponing RT. For patients who cannot travel or have no access to a radiation facility and are diagnosed with triple negative breast cancer, adjuvant capecitabine can be considered while postponing radiotherapy. So when is the best time to initiate neoadjuvant and adjuvant chemotherapy? Neoadjuvant treatment should start within 2 to 4 weeks of diagnosis and staging, while adjuvant therapy should begin within 3 to 6 weeks after surgery. What subsets of patients should be given high priority in giving neoadjuvant chemotherapy? They are triple negative breast cancer patients, chemotherapy in combination with targeted therapy for HER2 positive breast cancer patients, neoadjuvant and adjuvant endocrine therapy plus minus chemotherapy for high-risk ER positive HER2 negative breast cancers as defined by current guidelines, completion of neoadjuvant chemotherapy that has already been initiated, continuation of adjuvant capecitabine treatment in high-risk triple-negative breast cancer patients, and TDM1 in high-risk HER2-positive breast cancer patients in the post-neoadjuvant setting. Also for continuation of therapy in the context of a clinical trial, provided patient benefits outweighs the risks, with the possible adaptation of procedures without affecting patient safety and study conduct. Chemotherapy schedules may be modified to reduce visits to the hospital, like 2-weekly or dose-dense or 3-weekly regimens should be preferred. For example, there was no significant difference between giving weekly versus 3-weekly docetaxel in terms of quality of life, clinical response, and pathologic response among early breast cancer patients on neoadjuvant chemotherapy. However, in patients above the age of 65 years, the number of visits should be balanced with a substantially better tolerability of weekly paclitaxel when compared to 3-weekly docetaxel. Dose-dense regimens allow for the shortest duration of treatment but must be balanced with the higher risk of immunosuppression. Now, for those who undergo systemic treatment, how can we decrease the significant risk of immunosuppression during systemic chemotherapy? When utilizing chemotherapy regimens with intermediate or high risk of immunosuppression, such as anthracyclines, 3-weekly docetaxel, or 3-weekly platinum, patients should receive GCSF and prophylactic antibiotics for the prevention of febrile neutropenia should be considered. The use of dexamethasone should be limited as appropriate to reduce immunosuppression. Now, among HER2-positive early or locally advanced breast cancer who are low risk or elderly patients with cardiovascular or other comorbidities, how long can we discontinue treatment with anti-HER2 therapy? According to data from a prospective randomized trial, anti-HER2 therapy may reasonably be discontinued after 6 months instead of 12 months of treatment. Among patients with early or locally advanced breast cancer receiving anti-HER2 therapy, what is the allowable treatment delay? Ongoing adjuvant trastuzumab alone may be postponed by 6 to 8 weeks in patients at high risk of complicated COVID-19 infection. Now, for those on adjuvant trastuzumab, what is the preferred route of administration? Trastuzumab subcutaneous formulation is preferred, and when resources allow it, home administration can be used. Now, for the same subset of patients, who are the best candidates for neoadjuvant endocrine treatment? For postmenopausal women with stage 1 cancers with low to intermediate grade tumors, low Ki-67 proliferation index, high ERPR expression, and lobular breast cancers, endocrine therapy may be started first while surgery can be delayed. If given, this treatment should be continued for a minimum of 4 to 8 months. For those women with hormone-positive breast cancer who received neoadjuvant chemotherapy, can endocrine therapy be used after completing chemotherapy if surgery cannot be immediately facilitated? Sequential use of neoadjuvant endocrine therapy may be considered for postmenopausal women whose surgery will be delayed for more than 4 months. LHRH analog administration should follow the usual international guidelines since no additional risk is foreseen from those agents. They may be given with long-acting every 3 months dosing to reduce the visits or home administration of these medicines. The addition of oral targeted agents like CDK4/6 inhibitors, mTOR, or PIK3CA inhibitors, if locally available, to endocrine therapy may be delayed in first-line treatment or in situations where endocrine therapy alone is providing or is likely to provide effective tumor control. So what about for metastatic breast cancer? Chemotherapy schedules are the same as in early and locally advanced breast cancer. It may be modified to reduce visits in the hospital. Dose-dense regimens allow for the shortest duration of treatment, but must be balanced with the higher risk of immunosuppression. For these metastatic breast cancer patients, oral therapy is recommended to reduce hospital visits. Oral chemotherapy with capecitabine and vinorelbine, if locally available, is preferred. Among these patients, what chemotherapy regimens or agents are preferred? Early line chemotherapy, endocrine therapy, targeted agents, or immune checkpoint inhibitors likely to improve outcomes in metastatic disease. High priority for pertuzumab, trastuzumab plus chemotherapy may be initiated. Consider giving CDK4/6 inhibitors in ER-positive, HER2-negative breast cancer and chemotherapy plus atezolizumab in PDL1-positive TNBC or triple-negative breast cancers. For these patients receiving anti-HER2 therapy, how can dosing schedules be modified? Trastuzumab, pertuzumab, and related antibody drug conjugates for HER2-positive tumors may be given at less frequent dosing intervals as necessary. Patients with HER2-positive breast cancer with more than 2 years duration of tumor control and minimal disease burden with trastuzumab-based regimens may consider interrupting maintenance therapy. Monitoring for progression every 3 to 6 months via telemedicine is recommended. Trastuzumab and pertuzumab for metastatic HER2-positive breast cancer may reasonably be administered at longer intervals, like 4 weeks instead of 3 weeks. An mTOR inhibitor, P3KCA inhibitor, or CDK4/6 inhibitor be added to endocrine therapy among patients with metastatic breast cancer? During this pandemic, the decision to add mTOR, PIK3CA, or CDK4/6 inhibitors, if locally available, to endocrine therapy should take into account the burden of metastatic disease, the pace of disease progression, the possibility of using these agents later in the course of the disease, and the availability of other treatment options. The addition of oral target agents, if locally available, to endocrine therapy may be delayed in the first-line setting or in situations where endocrine therapy alone is providing or is likely to provide effective tumor control. For patients with advanced metastatic PD-L1 positive TNBC, first-line treatment can be defined based on biomarkers according to local practice and resource availability. Immunotherapy can be considered. Risks associated with immunotherapy with COVID-19 progression have not been clearly described, but close monitoring for patients with specific symptoms is recommended. Endocrine-based therapy is preferred for most patients with hormone-positive, HER2-negative metastatic breast cancer, not in visceral crisis, and should follow the usual international guidelines. Among patients with metastatic breast cancer, endocrine treatments like tamoxifen, aromatase inhibitors, LHRH agonists are safe and can be continued. LHRH analog may be given with long-acting, every 3 months dosing to reduce patient visits. Monthly home administration of LHRH analog by the patient or visiting nurse is preferred. Among patients with metastatic breast cancer, what indications may justify emergency breast surgery? Indications include breast abscess in a septic patient, an expanding hematoma in a hemodynamically unstable patient, as assessed by the surgeon. Emergency palliative radiation therapy is justified when there is bleeding, painful, inoperable locoregional disease, symptomatic metastatic disease such as acute spinal cord compression, and symptomatic brain metastasis not improving with steroidal medication, and any urgent irradiation with an expected impact in survival or a modifying effect on the risk of disabling sequelae and/or quality of life. Patients receiving chemotherapy should receive appropriate supportive care to reduce side effects. In particular, GCSF should be used to minimize neutropenia and can even be considered for regimens with less than 20% chance of febrile neutropenia, not usually offered GCSF. For patients who have no access or cannot afford GCSF or pegylated GCSF, dose reductions and dose interruptions should be considered. Among patients with bone metastasis, the use of bone modulating agents should be discussed on a case-to-case basis. depending on the burden of bone disease and the presence of symptoms. When there is no evidence of hypercalcemia or gross pain, consider deferring treatment or increasing the interval of administration to every 3 months. Moreover, administration of subcutaneous denosumab can be performed at home. Now for end-of-life care. Due to the additional risk associated with COVID-19, proactive advanced care planning is vital, especially for cancer patients. Discussions regarding end-of-life care, including advanced directives, should be done. Mental health issues should likewise be addressed. Psychological concerns of patients, like having to deal with delays in cancer management, fear of the risk of infection, anxiety, isolation, etc., should be addressed through telemedicine. Finally, for COVID vaccination, the Philippine Society of Medical Oncology strongly recommends that patients with cancer be vaccinated against COVID-19. This recommendation aligns with guidance from international and national professional organizations and government agencies. Currently available data show worse COVID-19 outcomes in patients with a history of cancer. Although vaccine effectiveness may be lower among patients who may be immunocompromised because of cancer or its therapy, vaccination can still reduce hospitalizations and deaths from COVID-19. This pandemic has forced us to rethink the way we approach the care of our patients. It caught us off guard and gave us little time to understand the disease and learn its management thoroughly. It challenged us to quickly find ways on how to best care for our cancer patients. Indeed, our patients are particularly vulnerable to the medical and psychosocial effects of the current health emergency. In the months ahead, we continue to expect changes in the status of this pandemic. We continue to be willing to adapt and evolve, remembering that the safety of our cancer patients, their family, and the healthcare workers are our utmost priority. We do our best to proceed with care, caution, and compassion. Thank you for your attention and for allowing me to share.
Thank you very much, Dr. Bill. Daghan kayong salamat sa mga information nga inyong gi-share sa amo karong hapuna. And Dr. Bill, let's greet all our viewers diri sa atong Zoom na natay mga 217 viewers at sa mga nanonood po sa ating FB page na umaabot na po tayo sa 60 million. Magandang hapon po sa inyong lahat. And kaway-kaway kayong lahat dyan. Come on everyone! Gusto kong itaas niyo po yung mga kanan na kamay at ilagay niyo po ito sa inyong mga dibdib. And habang kayo po'y nanonood sa isang napaka-espesyal na video mula sa ICanServe, sige, himas-himas lang po tayo sa ating mga dibdib. Let us all watch this.
May lunas ang breast cancer, lalo na kapag maagang nadiskubre sa pamamagitan ng sariling salat sa suso. Sinisimula nito pagtuntong sa edad 20. Ginagawa 1 linggo matapos ang regla o mens kung kailan ang suso ay hindi na masakit sa latin. Sa mga hindi na nagme-mens, regular ninyo itong gagawin sa parehong araw kada buwan. Ito ang 3 hakbang para sa sariling salat sa suso. Una, ang pagsusuri ng anyo o itsura ng suso. Humarap sa salamin. Ilagay ang mga kamay sa baywang at yumuko ng bahagya. Pangalawang hakbang, hilahin pasulong ang mga balikat at siko at damhin ang paninikip ng muscle sa dibdib. Ngayon mo tingnan ang anumang pagbabago sa suso. Punahin kung ang nipple ay pumaloob. Pagkatapos, pisilin ng bahagya ang utong o nipples at inspeksyonin kung may lumalabas. Pakiramdaman ngayon ang kilikili. Suriin ang kilikili habang nakaupo o nakatayo at ang iyong mga braso ay bahagyang nakataas para mas madali itong salatin. Mas mahirap ang pagsalat kung nakataas ng tuwid ang braso. Pangatlo sa inyong checklist, ang mismong pagkapa sa suso. Mahiga na ngayon ng lapat ang likod at nakataas ang kaliwang braso. Maglagay ng unan o tuwalyang nakabalunbon sa ilalim ng kaliwang balikat. Hindi ang dulo ng tatlong gitnang daliri ang gagamitin sa pagsasalat, kundi ang pinakaumbok ng tatlong gitnang daliring ito na kailangan ding siguraduhin laging magkadikit at palaging tuwid. Ilapat ang umbok ng mga daliri ng kanang kamay sa kaliwang suso. Salatin ang dibdib mula kilikili. Ulit-ulitin ito pataas at pababa hanggang masalat ang buong suso. Ngayon, salatin ang ilalim ng utong o nipple. Uliting muli ang mga hakbang ng pagkapa sa kanang suso gamit naman ang kaliwang kamay. May tatlong uri ng diin ang pagkapa. Ang magaan ay para maramdaman ang tissue na pinakamalapit sa balat. Ang katamtamang diin ay para maabot ang mas malalim na parte ng dibdib at ang pinakamariin ay para makarating sa mismong dibdib at tissue hanggang buto-buto. Tandaang gamitin ang bawat uri ng diin isa-isa. Huwag iangat o alisin ang mga daliri sa mismong suso hanggang matapos ang pagsasalat ng kabuuan nito para makasigurong walang makaligtaang bahagi. Huwag magulat kung maraming masalat na maliliit na bukol. Kadalasan naman ay normal ang mga ito. Sa paglipas ng mga araw, punahin ang anumang pagbabago. Kung tumitigas ba ang maliit na bukol o lumalaki. Magpaturo sa doktor, nurse, midwife at barangay health worker para siguraduhin tama ang ginagawang pagsasalat. Hindi lahat ng bukol ay cancer. Kung may madiskubring pagbabago sa iyong suso, pumunta at kumonsulta agad sa iyong doktor. Nasa kamay mo ang kinabukasan.
Ayun! Napakaganda. Very informative po na video mula sa ICanServe at boses po yun ng Miss Bibeth Orteza. Maraming salamat po sa pag-share niyo po ng mga impormasyon para po sa ating lahat na nanonood sa hapong ito. Again, sa ating 210 viewers or participants kasama natin sa Zoom at umabot na po tayo ng 70 million na nanonood po sa ating FB pages. I'm back, solo frame. At ngayon po, na-mention ko kanina, since ang topic natin is healing from the pandemic. Ayan. So medyo kayo po ay nag-aalala kung paano ba dapat inaalagaan ang ating mga balat. So ngayon po pag-uusapan natin, makakasama natin isang napakagaling ng dermatologist, Dr. Eve Therese Ramos. Magandang hapon, Doc Ramos.
Thank you. Hi, everyone. Today, we will be talking about the dermatologic effects of cancer treatment and what we can do about them. What's the body's biggest organ? You might be surprised to find out it's the skin, which you might not think of as an organ. No matter how you think of it, your skin is vital. It covers and protects everything inside your body. Skin holds everything together. It also protects our bodies, helps keep our bodies at just the right temperature, and allows us to have the sense of touch. Chemotherapy is an essential component in the multidisciplinary management of most cancers. Newer cancer therapies have led to an increased survival rate in patients. However, these treatments can cause changes in the skin, hair, and nails. Skin side effects are often mild, but they can be uncomfortable and noticeable, thus affecting the patient's quality of life. Skin reactions are usually temporary, and treatments are available to help patients cope with these side effects. More often, prevention is the best way to manage skin problems. Inform your doctor if you have any rashes, sores, wounds, or other issues with your skin. Sometimes an itch, pain, or discomfort is the first sign that a skin condition is beginning. Inform your doctor if you experience these problems, even if they are not visible. Early intervention is the key to prevent the worsening of these side effects. Chemo rash can be a side effect of chemotherapy, targeted therapy, immunotherapy, or radiation therapy. It may show up throughout cancer treatment, but it's most common in the first 2 to 3 weeks following treatment. It can appear in several different forms. It can look like acne or measles. There are several ways to manage a rash based on its severity. For a mild or a moderate rash, your doctor can prescribe steroids given as a cream. Your doctor may also suggest antibiotic creams or tablets. He or she may prescribe steroids to take by mouth and use as a cream for a more severe rash. Your doctor may also stop your chemotherapy for a short time and restart at a lower dose. If these steps do not work, he may refer you to a dermatologist for other treatments. Dry and itchy skin as a side effect may be more common for people with blood cancers, such as leukemia, lymphoma, and multiple myeloma. It is also prevalent with chemotherapy, targeted therapy, radiation therapy, and bone marrow transplants. Using moisturizers before starting cancer treatment will help enhance your skin barrier. Creams and ointments usually work better at hydrating the skin compared to lotions and gels. Use a moisturizing cream at least twice a day and within 15 minutes of showering. Right after showering, pat skin dry using a soft towel, then apply your moisturizer. On arms and legs, apply in a downward motion to prevent inflammation of the hair follicles called folliculitis. Avoid products that irritate the skin like soaps, detergents, and creams with fragrance. Fragrance is a potential irritant and allergen, and the alcohol content can cause more dryness. Avoid products that scratch or scrub your skin, such as sponges, bath scrubs, or loofahs. Shower and bathe with warm water. Hot water can dry the skin even more. When skin is dehydrated and cracked, use moisturizers containing urea, ammonium, or lactic acid. These will soften the skin and allow water retention. So how do we treat itchy skin? Avoid skin products with fragrance. Use creams with menthol, camphor, which are available over the counter. You can also use topical steroids prescribed by your doctor. Try using oral antihistamines or anti-allergy, but talk with your doctor about the itching before taking any medication. Some chemotherapy, radiation therapy, and stem cell transplants may make the skin more sensitive to light. This is called photosensitivity. To protect the skin from sunburns when outside, cover up with clothing or a hat. Avoid sun exposure, especially from 10 a.m. to 4 p.m. Use a sunscreen with an SPF of at least 30 and is labeled as broad spectrum. A broad spectrum sunscreen blocks both UVA and UVB rays. Mineral or physical sunscreens such as zinc oxide or titanium dioxide are best for very sensitive skin because they can be less irritating. Make sure to apply enough to cover your entire body, and reapply every 2 hours or every hour if you are swimming or sweating. Use sun protective lip balms as lips can also be susceptible. Cancer treatments may cause your nails to lift, break, or develop light or dark streaks or grooves. The cuticles surrounding your nails may also swell and become red and painful. To help manage any nail changes you experience, trim your nails, avoid manicures and pedicures, do not use artificial nails, wear gloves when doing dishes or housework. Use oils or creams to keep the skin around your nails soft. Avoid wearing shoes that are too tight. If an infection is suspected, soak nails for 15 minutes every evening in a solution of white vinegar and tap water in equal amounts. Radiation therapy also affects healthy skin cells, causing the skin to peel, itch, or hurt just like a sunburn. Skin damage from radiation therapy often starts after 1 or 2 weeks of treatment. Most often, it gets better a few weeks after treatment ends. If it becomes a problem, your doctor may change your radiation therapy dose or schedule until the condition improves. Skin can become very sensitive during radiation therapy. You can reduce the risk of side effects by following these tips. Wash the treated skin gently every day with warm water. Washing helps remove bacteria from your skin, which can cause an infection. Do not use washcloths, sponges, and loofahs. Instead, use your hands to splash water on the treated skin gently. Use a gentle, low pH cleanser if you need to cleanse. Gently apply it with your hands and rinse it off with warm water. Ignore the lines drawn on your skin. Trying to remove them will irritate your skin. Avoid shaving the treated area. Applying moisturizers every day helps your skin recover more quickly, but don't apply moisturizer to a wound. Skip the antiperspirant and talcum powder. Ingredients in these products can increase the amount of radiation you get. Don't apply anything sticky to your skin, such as medical tape, stick-on bandages, and nicotine patches. The adhesive can irritate and damage skin treated with radiation. Take a break from products that contain fragrance. Wear loose-fitting clothes. You can develop side effects if clothing rubs against the treated skin. Cover your treated skin with sun-protective clothing. A wide-brimmed hat can protect your head and neck. Use broad-spectrum sunscreens with SPF 30 or higher. Skip the hot tub. Heat can irritate your skin. If the tub hasn't been properly cleaned, you could also develop a severe infection. Don't put anything hot or cold on your treated skin. Protect your treated skin while doing chores. If you are getting radiation treatments on your hands or lower arms, protect it with gloves. Steroid skin creams may help prevent skin changes from radiation therapy. Tell your doctor if you see any open sores, for this may be a sign of an infection that needs treatment with oral antibiotics. What is hand-foot syndrome? It is a side effect of some chemotherapy drugs that can cause redness, swelling, and blistering on the palms and soles of the feet, similar to a sunburn. A topical steroid may be prescribed for swelling or inflammation, and cancer treatment may be postponed until symptoms improve. The dose of chemotherapy may also be adjusted to manage this side effect. Start applying moisturizers before starting treatment. Use thick, unscented creams at least 2 times a day. Wear gloves when washing dishes. Avoid direct sunlight. Avoid tight-fitting gloves, socks, or shoes. Avoid picking at dry skin or breaking any blisters. Inform your healthcare team if you develop fever, chills, bleeding, drainage from sores, or if hands and feet become increasingly painful. Targeted therapy and immunotherapy are more specific treatments than chemotherapy. Targeted therapy and immunotherapy side effects may include the skin, hair, nail, and eye problems. Your oncologist would discuss the possibility of these side effects with you. Certain kinds of targeted therapy focus on molecules that fuel the growth of cancer cells and also plays a role in the normal development of the skin, hair, and nails. So, rashes and changes to the hair and nails may occur during treatment with these drugs. Most people taking these drugs develop a rash on their face and upper body. It usually happens within the first few weeks of taking these medications. You may notice redness or a warm sensation like a sunburn before the rash begins. After several days, pimples may appear and the surrounding skin feels slightly tender. Rashes are usually mild to moderate, but some people have severe rashes that cause significant physical and cosmetic discomfort. The skin can also become very dry and itchy, interfering with daily activities and sleep. The skin on the fingertips may crack. The skin may also become more sensitive to sunlight. A lot of scratching can result in breaks in the skin, and these openings make the skin more prone to infections. Inflammation around the nails can make grooming, dressing, and other activities painful or difficult. Now, how about immunotherapy? Immunotherapy is also called biologic therapy. It is a type of cancer treatment that boosts the body's natural defenses to fight cancer. Many side effects are similar to those of an allergic reaction. They depend on the specific drug but may include skin, hair, nail, or eye problems. Rashes, dry skin, and nail and hair reactions are rarely severe, but they can cause significant discomfort. Patients may even want to stop cancer treatment because of these reactions. It is essential to talk with your doctor about what to expect. Also, tell your doctor as soon as you start feeling or seeing any side effects. There are early and effective treatments for these reactions. The following suggestions may help avoid reactions and help relieve them if they do happen. At the first sign of a reaction, tell your doctor or a dermatologist. Symptoms of a reaction include a warm or burning sensation, pimples, nail cracks, or dry skin. The precautions and advice that I previously mentioned on sun protection also apply here. Avoid anti-acne skin products that have alcohol or retinoids, for they can dry out your skin. Your doctor may prescribe medicated skin creams for a rash. If the rash is severe or covers a large part of the body, you may need oral steroids. Some oral antibiotics are an effective therapy for rashes and nail tenderness. Whenever there is a discharge of pus, your doctor may take a sample to help choose the best antibiotic treatment. For hand-foot skin reactions, use creams containing urea or salicylic acid. Potent steroid creams are also options. Wear thick, comfortable socks and shoes, and do not put too much weight on your hands and feet, especially during the first 2 months of treatment. For itching in one specific area, your doctor may prescribe a topical medicine. For more generalized itching or itching that affects sleep, talk with your doctor about taking an antihistamine such as cetirizine or diphenhydramine. Healthy skin promotes overall health and has the potential to boost your confidence as you move about and socialize in the world. Your skin is the organ that comes into contact with the rest of the world. Healthy skin is an asset to the body. Having cancer, undergoing its treatment, experiencing the side effects may affect your quality of life. Taking care of your skin is your and your doctor's responsibility. I hope that the information I imparted can help empower you to do your share in your recovery. Thank you for your kind attention.
There you have it, ladies and gentlemen. Very informative. And thank you so much for sharing those informations, Dr. Eve Therese Ramos. Maraming salamat po. And now, for our last topic for tonight, we'll be discussing another interesting one. Ito po yung mga pagkain na dapat kinakain ng mga cancer patients. And to discuss more about this, we have here a clinical nutritionist, Dr. Maricel B. Malazarte.
Specializing on. Good evening, I'm Dr. Maricel or Matel Malazarte, a Cebu-based internist specializing on adult medical nutrition. Today, I'll be talking about how we can benefit from good nutrition in our fight against cancer. Although most of my lecture will be talking about food choices, these recommendations encompasses a broader outlook and a more holistic approach to making healthy lifestyle choices which can have a huge impact on preventing some forms of cancer and other non-communicable diseases. To start off, the World Cancer Research Fund and American Institute for Cancer Research panel of experts have provided us with 10 cancer prevention recommendations. But for tonight's forum, I will be focusing on 8 of them. So first, we have the cancer prevention recommendation, which is to keep your weight within the healthy range and avoid weight gain in adult life. Not only are we affected by the COVID-19 pandemic, but by 2016, being overweight and obese, it has reached a point of going to a global scale with an estimated 1.97 billion adults and over 338 million children and adolescents have become affected. There is also strong evidence that shows greater body fat can cause many cancers, and this evidence has strengthened over the last decade. Studies have shown that greater body fat is a cause of cancers of the esophagus, pancreas, liver, colorectum, breast, kidney, and probably also is a cause of cancers of the mouth, pharynx, and larynx, stomach, gallbladder, ovary, and prostate. And gaining weight in the adult life is also a convincing cause for both postmenopausal breast and endometrial cancer. So maintaining a healthy weight throughout life is one of the most important ways to protect against cancer. Overweight and obesity, it's generally assessed by the body mass index or BMI and your waist circumference. It has been seen to be more prevalent than ever. And the body mass index is a measure that uses your height and weight to work out whether your weight is within the healthy range. Simply put, body mass index or BMI is a calculation of your size that takes into account your height and weight. So to compute for your BMI, you simply divide your weight in kilograms by your height in meters squared. So for example, I am 132 pounds and at 5 feet and 5 inches. First, you convert your weight in pounds to kilograms. So 132 pounds to be converted into kilograms, you divide by 2.2. So that gives me 60 kilograms. And then you convert your height to meters. 65 inches multiplied by 2.54 centimeters would be equal to 165 centimeters. And to convert it to meters, divide by 100. So that gives you 1.65 meters. To compute for your body mass index, so its weight divided by meter squared. 60 kilograms divided by 1.65 divided by 1.65 meters, which gives you a BMI of 22. So where does that put me in the WHO classification for the BMI or body mass index in the Asia Pacific region? So I am within the normal weight, but dangerously close to being overweight because I'm already at 22. And the overweight at risk would start at 23. So what are our goals for being a healthy weight? We have to ensure that our body weight or the body weight during childhood and adolescence would project towards the lower end of the healthy adult BMI range. And you keep your weight as low as you can within the healthy range throughout life. So that's the range between 18.5 to 22.9. Avoid weight gain throughout adulthood. For some cancers, the increase in risk is seen with increasing body fat even within the so-called healthy range. Nevertheless, most benefit is to be gained by avoiding overweight and obesity. Overweight in childhood and early life is liable to be followed by being overweight and obese in adulthood. And because of the relationship between body mass index and body composition would vary between the ethnic groups, there's different reference ranges that is being proposed for us in the Asia Pacific region. And this is the one that we are going to use, the WHO classification of body mass index in the Asia Pacific region. So how to calculate your ideal body weight now? So what is an ideal body weight? It is an estimate of an individual's healthy weight, and it should be based on certain parameters, most notably your height and your gender. And this value is the optimal weight for a given height that would correspond to a favorable fitness and nutrition status. So maintaining an ideal body weight is associated with a decreased risk for chronic health issues and early mortality. On the other hand, obesity is associated with an increased prevalence of cardiovascular disease, hypertension, diabetes, and even certain forms of cancer. So calculating your ideal body weight should be one way to ensure you are maintaining a healthy weight. So how do we calculate our ideal body weight? For females, we start off with 100 pounds at the first 5 feet. Then you add 5 pounds for each additional inch. For males, you start with 106 pounds at 5 feet and add 6 pounds for each additional inch. So that is how you compute for your ideal body weight. So how can I be a healthy weight? This recommendation can best be achieved by maintaining energy balance throughout life, by being physically active, eating a diet rich in whole grains, vegetables, fruit and pulses, such as your beans, limit your fast foods and other processed foods in the form or those with high fat, starches, or sugars, and limit your sugars or your sugary drinks. So now we go to the second cancer prevention recommendation, which is to be physically active as part of your everyday life. So, walk more and sit less. There is a strong evidence that physical activity projects against cancers of the colon, breast, and endometrium, and that it helps prevent excess weight gain. Sedentary lifestyle and lack of physical activity are globally widespread, especially now that we have frequent lockdowns that are occurring because of the COVID-19 pandemic. So our goals for being physically active is to be at least moderately physically active and follow or exceed your national guidelines. So limit sedentary habits, and those people whose work is sedentary would need to take special care to build physical activity into their everyday lives. So the World Health Organization advises adults to be active daily and do at least 150 minutes of moderate physical activity or at least 75 minutes of vigorous physical activity a week. We consider this the minimum amount necessary. So there is convincing evidence that physical activity of moderate or vigorous intensity would protect against colon cancer. Physical activity probably protects against postmenopausal breast cancer and endometrial cancer. Physical activity at vigorous intensity would probably protect against premenopausal breast cancer. There is convincing evidence that walking protects against weight gain, overweight, and obesity. Aerobic physical activity would probably protect against weight gain, overweight, and obesity. There is also strong evidence that screen time, which is a marker of sedentary living, is also a cause of weight gain in children and adults. So those who are very fond of doing Netflix and chilling, this might be a good time for you to be physically active. We know that the greater body fat is a cause of many cancers, and therefore, physical activity may indirectly reduce the risk of obesity-related cancers. So one of our cancer prevention recommendations is to make your whole grains, fruit, and pulses like your legumes, such as beans and lentils, a major part of your usual daily diet. There is evidence that eating whole grains, fiber, vegetables, and fruit can help protect against certain cancers as well as weight gain, overweight, and obesity. Eat at least 30 grams of fiber and at least 400 grams of fruit and vegetables each day. There is strong evidence, again, that eating whole grains would protect against colorectal cancer, and eating fruits containing dietary fiber protects against colorectal cancer and against weight gain, overweight, and obesity. Although the evidence for links between individual cancers and consumption of non-starchy vegetables or fruit is limited, the pattern of association and direction or the effect are both consistent. So overall, the evidence is persuasive of a protective effect, and greater consumption of your non-starchy vegetables and or your fruits would help protect against a number of digestive cancers and some other cancers. So dietary patterns that are linked to a lower risk of cancer consistently feature your high consumption of this set of food items. So what should we be eating? Okay, so non-starchy vegetables and fruit of different colors. The more colorful your plate is, we call it the rainbow plate, the better. So that means it's a variety of your vegetables and fruits. So non-starchy roots and tubers like your carrots, your artichokes, your celery root, turnips, or your whole grains. So what are whole grains? Examples of would be your brown rice, the wheats, your oats, barley, and rye. So what or how would 30 grams of fiber translate? So here we have examples of your vegetables and fruits and of how many grams you need to take to be able to achieve 30 grams of fiber per day. How many servings I need? So for example, if you already consume half cup of kidney beans in one plating or one serving, you already reach 23 grams of fiber. And you pair it with like a piece of mango, that gives you another 5 grams. So that gives you 28 grams of fiber already. And then you snack on like a piece of 3 pieces of prunes of 3 grams. So that would total about around 31 grams in a day. So it's just about mixing and making sure, or at least you can hit, or a greater chance for you to hit 30 grams of fiber per day by achieving or eating at least 5 servings of fruits and vegetables per day. So your dietary goal would be to consume a diet that provides at least 30 grams of fiber per day from your food, and to include foods containing whole grains, your non-starchy vegetables, fruits and pulses like your legumes, beans and lentils in most of your meals. You eat a diet high in all types of plant foods, including at least 5 portions or servings, or at least 400 grams or 15 ounces in total of a variety of non-starchy vegetables and fruit every day. If you eat starchy roots and tubers as staple foods and eat non-starchy vegetables, fruit and pulses regularly, so you incorporate this, if possible, into your meal. So concentrate on your non-starchy vegetables. So next we have limiting your fast food or your fast foods and processed foods. So limit your fast foods and other processed foods high in fat, starches, or sugars, as this would help control your calorie intake and maintain a healthy weight. Again, there is strong evidence that diets containing greater amounts of fast foods and other processed foods high in fat, high in starches or sugars, and consuming a Western type of diet, which is characterized by a high amount of free sugars, meat, and fat, are causes of weight gain, overweight, and obesity by increasing the risk of excess energy intake relative to expenditure, meaning you take in so much energy, you get excess energy from so much calorie, and sometimes these are empty calories, non-nutrient calories, and paired with your sedentary lifestyle, you tend to gain more weight in the end, tend to become overweight, leading even to obesity. And again, like we have mentioned a while ago, greater body fat can cause or has been linked to many of the cancers. So there is strong evidence that glycemic load is the increase in your blood glucose and insulin after eating your food, is a cause of your endometrial cancer. And fast foods are readily available convenience stores that readily available convenience foods, that tend to be energy dense and are often consumed frequently and in large portions. So it has been noted that fast foods and studies of fast food such as your burgers, your fried chicken, your chips, french fries, and high-calorie drinks containing your sugars such as your cola or your fat, those drinks containing fat like your shakes, this food undergoes some form of processing before consumption. And more highly processed foods have generally undergone industrial processing and are often higher in energy with lower micronutrients. So now we proceed to limiting your intake of red meat and processed meat. So you just do moderate amounts of red meat with little, if any, of the processed meats. So eat no more than the moderate amounts of red meat and little if you do take any processed meats. There is strong evidence that the consumption of either the red or processed meats are both causes of your colorectal cancer. But take note, this recommendation is not to completely avoid eating meat. Meat can be a valuable source of nutrients, in particular protein, your iron, your zinc, and your vitamin B12. So what is red meat? Red meat is all types of muscle meat from your mammals. So this would include your beef, your veal, pork, lamb, mutton, horse, and goat. So what are processed meats then? Meats that have been transformed through salting, curing, fermentation, smoking, and other processes that would enhance the flavor or improve the preservation. So processed meats can include your ham, salami, bacon, and other sausages such as your frankfurters and chorizo. So minced meats such as your fresh sausages may sometimes, although not always, count as processed meats. So what is our dietary goal in terms of red meat and processed meats? If you eat red meat, you have to limit your consumption to no more than 3 portions per week. 3 portions is equivalent to around 300 to 350 to 500 grams, around 12 to 18 ounces of cooked weight. So consume very little of your processed meats in case you do consume them. So the amount of red meat specified was chosen to provide a balance between the advantages of eating red meat as a source of the essential micro and macronutrients and a disadvantage of increased risk for colorectal cancer and other non-communicable diseases. So remember, just to limit your portions to 3 portions per week. And what does a 350 to 500 gram portion mean? So look at the picture. It is the size of a deck of cards. Okay? You're allowed that much protein in the form of red meat. So what's shown here is chicken and fish. Are they red meat? No. You can use them as an alternative and with the same amount of portions. So in case that there are days that you cannot eat your red meat, you may alternate this with your eggs, your poultry, or your fish. So now we go to the 6th recommendation, and it is to limit the consumption of sugar-sweetened drinks. And drinks should be made mostly of unsweetened drinks or just go for the healthy choice, which is water. The consumption of sugar-sweetened drinks is seen or have been found to be a cause of weight gain, overweight, and obesity in both children and adults, and especially when consumed frequently and in large portions. The sugar-sweetened drinks would do this by promoting excess energy intake compared to the energy expenditure, same as the intake of your fast foods and processed meats. Consumption of sugary drinks is increasing in many countries worldwide, and this is contributing to the global increase of your obesity, which increases the risk or is linked to many kinds of cancers. For example, there's a strong evidence that great body fat, as mentioned before, is a cause of the cancers of your mouth, pharynx, larynx, esophagus, the stomach, your pancreas, gallbladder, liver, colorectal, breast, ovary, endometrium, prostate, and your kidney. So obesity has been linked to cancer, and this is why we need to limit our sugar-sweetened drinks. So opt for water if you can. So the American Heart Association would recommend limiting your sugar intake for men at least 9 teaspoons per day. Women, it's 4 teaspoons per day. How much grams of sugar is there in 1 teaspoon? That's 4 grams of teaspoon. So if you want to translate that to grams of sugar, for women, you're allowed 6 teaspoons times 4 grams per teaspoon. That's equivalent to 24 grams of sugar per day. So our dietary goal, we do not consume sugar-sweetened drinks. So now you ask about, are we allowed to take, how about tea though? How about coffee and fruit juice? So to maintain adequate hydration, it is best to drink water or unsweetened drinks, such as your tea or coffee without the added sugars. There is some evidence that coffee probably protects against liver and endometrial cancers. Fruit juices should not be consumed in large quantities, even those without added sugar, as they're likely to promote weight gain similar to your sugar-sweetened drinks. Although there is no strong evidence in humans to suggest that artificially sweetened drinks with minimal energy content, such as your diet sodas, are a cause of cancer, the evidence that artificially sweetened drinks can help prevent weight gain, overweight, and obesity is not consistent. So the best thing to do is just drink your water and avoid your sugar-sweetened drinks. So next we have the cancer recommendation to limit your alcohol consumption. For cancer prevention, best not to drink alcohol at all. So the consumption of alcoholic drinks is a cause of cancers of the mouth, pharynx, larynx, esophagus, your liver, colorectal, and breast, as well as stomach. And this justifies the recommendation to not drink alcohol drinks. And there's also strong evidence that the consumption of alcoholic drinks would help protect against kidney cancer. However, this finding is far outweighed by the increased risk of the other cancers. So, does the type of alcoholic drink make a difference? The evidence shows that the alcoholic drinks of all types have a similar impact on cancer risk. And this recommendation, therefore, would cover all types of alcoholic drinks, whether beers, wines, spirits, liquors, or other drinks, as well as other alcohol sources. An important factor is the amount of alcohol or ethanol consumed. Even in small amounts of alcoholic drinks can increase the risk of several cancers. There is no threshold for alcohol consumption below which you can say that because I'm consuming only this amount, cancer risk does not increase. Well, there are cancers that can actually be triggered by just taking a small amount of alcohol. So bottom line is, as much as to cancer prevention, it is best not to drink alcoholic drinks at all. So lastly, what about the role of supplements for cancer prevention? So this recommendation actually would tell us not to use supplements for cancer prevention, rather aim to meet the nutritional needs through diet alone. A dietary supplement is a product that is intended for ingestion that would contain a dietary ingredient intended to achieve levels of consumption of micronutrients or other food components beyond what is usually achievable or can be reached by eating alone. There is strong evidence that your randomized controlled trials using high-dose beta-carotene supplements may increase the risk of lung cancer in some people. And there is no evidence that says that dietary supplements, apart from calcium in the support of colorectal cancer, can actually reduce cancer risk. So exception, calcium for colorectal cancer, but otherwise, no strong evidence that tells us that dietary supplements can actually help reduce cancer risk. For most people consuming the right amount of food and drink, you're most likely to protect against cancer than or compared to taking dietary supplements. So when can we take our supplements? This panel of experts recognize that dietary supplements, in addition to varied diets, may at times be beneficial for specific population groups, and these are vitamin B12 for people above 50 years old who might have issues of absorbing your vitamin B12 naturally, and iron, provision of iron and folic acid supplements for women who may become pregnant or are pregnant, vitamin D supplementation for infants and young children, and for pregnant and breastfeeding women, although the specific recommendations for iron and vitamin D supplementation may vary between countries. So, randomized controlled trials of high dose supplements have not consistently demonstrated the protective effects of micronutrients on cancer risk, as suggested by observational epidemiology. Also, some trials have shown potential for unexpected adverse effects. So, only use your supplements if you are deficient for a particular vitamin or if is recommended by your doctor. But to add or to use your supplements as a cancer prevention method, you might as well meet these nutrients by eating the right kind of diet and the right amounts. So that ends my lecture for tonight, and thank you for listening.
Ayun, thank you very much, Dr. Maricel Malazarte. Mali po yung na-press ko. Ayun po yung na-press ko. And napaka-informative po no topic na yon, nutrition. And now, ladies and gentlemen, alam ko marami po kayong mga katanungan mula nung nagsimula kami kaninang mga 4:00 ng hapon. Kaya we were able to gather most of your questions and para tulungan po tayo niya na ma-discuss and to summarize everything, makakasama po natin ang past president ng PSMO, Dr. Ellie May Villegas. Mayong gabi, Doc.
Good evening, everyone. Kita mo tanan? Ipanggutom na.
Gamay. Bawal ang sugar, Doc.
Oo, bawal ang sugar. It's already 6:45, but that's okay. Wa man siguro tay deadline. We don't have a want to sawa ni siya.
Yes.
Yes. Pero just a little break. Kuan man ang PSMO, Erwin, very, what do you call this, very generous.
Uy,
We have
mukanta si
lots
Dr.
of prizes
Emek.
to give. We will provide, we will have a trivia, quick game. So what the audience will do, unhanay lang ha, you can type in the chat box your answer. The first person to what do you call this, to type, then will be the winner. So you will be getting your details so that we can send you the prize. It's like 5 boxes of KN95 masks.
Wow.
Okay. In the pandemic, and to heal from it, you still have to follow safety precautions. So is everyone ready? Ngayon ta ko nga kinsay kinagwapuhan sa katong tatlong itlog. Difficult to answer man na ay. So, first one to type ha. So, how many teaspoons of sugar for males is safe? Who is
Nasakto dyan ko.
who's the winner?
Malinaw
Who's the
ko,
winner?
ha?
I cannot see, Erwin.
Ako rin. Si Miss Melay will help us. Apat ang mata ko, Doc, pero
Yeah.
mahina ang kalaban.
Dr. Mattel, what is the correct answer? Is it 9? Is it 6?
9 teaspoons per male, 6 per females.
Okay, so 9 teaspoons, Myres. You think Myres Ludo?
Wow, everybody listen.
Yes.
Thank you for that.
Congratulations, Myres of Mactan, Shangri-La. You don't need the mask. We will send you the mask. Just send, just type in the chat box where you want them delivered. Okay, so let us start our question and answer now.
Yes, Doc. Go ahead.
Thank you
Excited
very
na.
much to all our eloquent and very gracious speakers, our medical oncologists, Dr. Arnold Uson, Dr. Bill Ramos, our PSMO president, our dermatologist, Dr. Eve Ramos, and of course, our clinical nutritionist, Dr. Matel Malazarte. The first question is for Dr. Usman. If you've been infected with COVID, is it still necessary to be vaccinated? And is there any vaccine brand which is the best for cancer survivors?
Okay. It doesn't mean that we have a COVID infection that we are already immune to the disease and we mount a good antibody response. There is no data that says na kung nag-infection tayo, pwede na tayo lifelong or prolonged immunity. But in the studies of vaccine, it is protected that vaccine do protect us. It's not the infection itself. So even if you have infected, yes, you still have to have the vaccine. Number two, what is the another question? Another question is, what type of vaccine? Yeah, what type of vaccine? All these vaccines have undergone trial and they are FDA approved. So no typical or no specific vaccine is recommended for any of them. Any those are available at that time is what we need.
All right. So, wag pumili kung
Wag
ano yung
pumili.
vaccine available, yun yung safe para sa inyo.
Kasi
Unless,
yung
of course,
COVID baka mauna.
oo, mauna ang COVID. Sa kakaantay mo, mauna ang COVID. Ayun, nakakamatay.
Delikado.
I have a question for Dr. Bill Ramos. For newly diagnosed breast cancer, can the patient just do teleconsult instead of face-to-face? Newly diagnosed. So I guess galing sa surgeon, tapos may cancer. Ayun yung pumunta ng clinic, gusto lang niya teleconsult.
For newly diagnosed, it's really preferred that you see the doctor because it's not just what you can do actually initially just to shorten the if you're really worried about the actual clinic visit. Initially, you can opt for telemedicine so that you know your files already there, your files already reviewed by the doctor, so that your clinic visit will be a little shorter. No, but the evaluation of the doctor. Especially regarding your treatment, would also include the examination. The doctor will evaluate your performance status and usually your capacity to handle the treatment, something like that. Now, it's usually better evaluated in actual clinic consult.
Yeah, thank you, Dr. Bill. And Dr. Eve Ramos, grabe production ang presentation ni Eve. Thank you, Dr. Bill, for the production of
Dr. Bill.
beautiful presentation. Biang, can cancer patients still use skincare products? So I guess they're using, and can they continue using? And if they do use skincare products, which ones are best to use?
While doing chemotherapy?
Yeah, well, undergoing treatments.
Oh, okay. So it's best to avoid like your anti-acne medications like your retinol and your toners that contains alcohol. So it's best to avoid those to avoid more irritation and dryness of the skin. So the sunscreens, of course, you need to maintain. But for the others, like your retinol and your toners, you need to stop it first until your chemo's done.
Are there toners which are not alcohol containing?
Yes, there are non-alcoholic toners.
So that you can use, or toners per se?
Yeah, it depends also if you have sensitive skin, because the chemo can increase the sensitivity of the skin. So you can try.
Correct.
Non-alcoholic toners.
Okay, thank you so much. Dr. Maricel Malazarte Matel, thank you very much for that informative lecture. So there's a question in Messenger. Grabe no, Messenger, Facebook. Daghan kaig tan-aon. How to convert grams and teaspoon to layman's term?
Are we talking about the sugars?
They're talking about the
are we
sugar.
talking about the meat?
First the sugar. Yeah.
The sugars, per 1 teaspoon of sugar, that's 4 grams. So 1 teaspoon equals 4 grams of sugar. And then if we're talking about meat, a portion of your serving per meal, you can do the hand portion so that it's easier. Just take out the fingers, use this one, the palm, and that's the size of the meat. It's like the same size of your deck of cards. So
Okay.
that's easier for you to check. And also the thickness of your hand. So ako mas dako-dako, so pwede pa ko baga-baga pa.
Yeah.
So so that's how you put, not include the fingers.
Okay.
So that's a portion of the meat. And for example, you're taking fish like mga bangus or flat fish, then imagine a checkbook. So that's the size of the portion for the fish na flat fish.
Okay. So you have to have a checkbook.
Just imagine na lang.
Yeah.
Advantage na kung bagain mong kamot.
True. So akong baliktaron, I will
It will
start with
correspond also to how much requirements is needed for your body and your weight.
Yeah.
For your body type and your height, your weight.
Correct. So I will reverse. I will start with Mattel for the second step. For a patient with hyperlipidemia, I guess high cholesterol or triglyceride, how much eggs can one safely eat per week?
Actually, you can eat your eggs at least twice a week if you include the yolk. Twice a week lang. Pero if you take out the yolk, that's where your cholesterol is, you can just use your egg whites. Then you can actually use it daily if you want. Pero it's small, it's tiring. You will have taste fatigue. There are other options. And I would prefer that you go for plant-based protein sources. No? And if you want to know the best diet, it's the Mediterranean diet. So it's focused more on plant-based sources for your protein and even your carbohydrates. And the good thing about the Mediterranean diet is it's a lifestyle. So what's good about nutrition is to encompass both your food intake and the lifestyle. So you also have to enjoy your food, know which foods that you should be taking, how much portions you should be taking, all about mindful eating.
Correct. That's very true. And for Dr. Eve Ramos, I'll just squeeze in two similar questions. Can a cancer patient still have reband or tattoo eyeliner? And there's another question related to that. Is eyebrow tattooing or microblading safe for certain people? Or is there a contraindication to eyebrow tattooing and microblading? And the relative question is, can a cancer patient can still have rebond, I guess, after the hair comes back?
After treatment, when your hair is healed already and it's back to normal, that's the time you can do your hair treatments. Regarding tattooing, I don't think there's a problem as long as your skin is totally healed already.
Yeah. And for those undergoing chemotherapy, especially katong those chemotherapy nga maka-down sa immune system, so we do not recommend microblading because there might be cuts and then your WBC might be low at that time that you had that procedure and you'll just introduce infection. Hair color is safe for breast cancer? Of course.
Hair color after treatment.
Yeah. So let's go to Dr. Bill Ramos. This is actually an offshoot from a question on Facebook. Do you doctors also get sad when your patient dies?
Yes. Yeah, we're just human. It's actually healthier to express your emotions rather than not express your emotions. So it's a healthy thing to be okay and to be not okay when you're really not okay. No. So what's good is to be aware of our emotions, whether you're a doctor or you're a patient. And being aware of the right emotions that you're feeling at the moment is a big step already. Accept that you're sad, then the lesser chances it will be a difficult situation. Usually, it becomes a problem when you resist. You don't accept that you're sad when you're really sad. So the same applies whether you're a doctor or you're a patient or whoever. The emotional health is a big factor for our quality of life.
Thank you, Bill. And for Dr. Uson, although Dr. Uson answered this already in the Q&A box, but there is a patient who's very afraid to receive COVID vaccination. But nung nag-chemo daw siya, cycle 1, okay naman. Ano daw dapat gawin?
Okay. Again, there is always the anti-vaxxers and always because the anxiety is coming from probably when you hear most of the time in the social media. So I always tell my patients, alam mo dati, yung mga polio, when I was younger in the high school and elementary, marami sa amin may polio. O sa mga, at least sa school, no? Now you don't see this already in our children, in the young ones. It's because people listen to the government, listen to the expert, that vaccine works. During that time, wala po tayong social media. Kaya ngayon, wala na tayong polio, wala na tayong smallpox, wala bira yung measles, wala na tayong mumps. Ganun po yun. Ngayon, marami na masyadong nagkakaproblema kasi marami na tayong sources of information. Number one, as NCCN, ESMO, yun po yung mga societies of medical oncology. Kasama po kami sa Philippine Society of Medical Oncology, which are experts practically on cancer and also the experts on vaccines. Doon po tayo maniwala, doon po tayo makinig kasi wala naman po. As you tell us, sabi mo nga, nalulungkot kami sa mga pasyente kasi yun po ang aming ang ginagawa, which is really to try to help our patients. So please listen to the experts and listen to the recommendation of the government and the DOH. Huwag po kayo matakot. Yung pong vaccine, kunyari, chemotherapy, nagkaroon kayo ng reactions, meron po yun. But meron po tayong, these are expected reactions. That's why may mga pre-medication pa nga tayo. Pero yun po, na ma-manage, hindi naman kailangan. Yung COVID po ang mahirap i-manage. Pag naunahan tayo ng COVID, pwede po tayong mamatay sa COVID at karami-rami na pong namamatay sa COVID na hindi na vaccinate.
Thank you, no? And I must also, corollary to that, na-survive mo nga yung chemo. Yung vaccination, walang-wala yun.
Walang-wala.
Therapy, yeah. Chemotherapy is not that easy, but it's needed and it's very tolerable and bearable, the side effects. How much more with vaccination, no?
True.
Pare-pareho lang yan. And there is a question for Dr. Matel Malazarte. Can cancer patients eat anything in moderation? Is this true?
Actually, yes. Para sa akin, no bawal. So I actually encourage my patients to eat what they feel like eating, especially when you're going through treatment. And this is the time that you feel a lot of gastrointestinal symptoms. And part of that is nausea, you have anorexia, so you don't have, wala kang gana to eat. And that the thing that is much more worrisome compared to what's bawal and what's not bawal is the amount of food that you're taking in. And this little portions of food that you miss out because you're so scared of eating the wrong kinds of food, the tendency is for you to be pushed to more malnutrition in the end. And then this is worse when it comes to patients going through treatment and where we need the full support of nutrition. It's even at the start of diagnosis, the nutrition support should already be there. You should be building up. And throughout until the recovery phase, nutrition will always be there. And it is the moderation of and the proper portions that you have to take mind of, or like I mentioned a while ago, mindful eating. Already gave the guidelines kanina, and I hope that some of the guidelines of the healthy way to eat could be instilled in your minds that at least when you do mindful eating, when you tend to choose the unhealthy food, you remember that there are more benefits to choosing the right kinds of or the right items of food for you now that you know that you have cancer. So, but if you do crave, you may still have your portions because sometimes when you have that craving, it will entice you to eat more. And I'll be happy if you eat more.
Yeah, just in moderation. And I guess that answers the two questions also. If is dairy contraindicated in cancer patients, and can we eat and can we drink milk? Of course you can.
You can.
Yeah. Then for Dr. Eve Ramos, what is the best skincare regimen that you can advise for those undergoing chemotherapy? So I guess they're asking your regimen, Bianca, because you have flawless skin.
First off, it's really sunblock, no? Because the radiation from the sun causes much damage to the skin, no? So it should be a daily regimen. And of course, the use of mild skincare products, preferably the unscented ones, no fragrance, especially for chemo patients, no fragrance, no coloring.
Okay. And pampakapal ng buhok. Nag-take po ako ng tamoxifen, nalagas po yung buhok. Naku po, hindi po yan dahil sa tamoxifen, baka po dahil yan sa chemo bago kayo nag-tamoxifen. But anyhow, I guess she's asking Dr. Ramos if what are the recommended hair products for those who've had hair loss from chemotherapy to hasten the regrowth, I guess.
Loss from chemotherapy is temporary, no? So hair regrowth is expected about 1 to 3 months after the end of your therapy. What you can do, of course, you take care of your general health, your nutrition, no, and with regards to supplements, we can take vitamin B, specifically biotin, which can help with your regrowth, biotin, zinc, and your antioxidants such as your tocotrienols, your vitamin C and E.
Okay, noted. And to Dr. Bill Ramos, is there a certain preparation before a patient goes for follow-up at the clinic? Maybe she was asking about the
Okay. I don't know. I don't.
PCR needed.
Yeah, some doctors are. Most clinics would require a health declaration either at the clinic or before you make your appointment, things like that. Some doctors would ask for swab test. I know some who would ask for that one. No, so again, perhaps to shorten your clinic visit, try to be ready with your list of medications, with your photocopy of your test results, things like that. No, that would really shorten your clinic visit. I think some doctors would also limit the number of people inside the clinic. So, kana siya, ready na lang for the patient himself or herself to take care of everything while inside the clinic. I think those things can actually shorten the clinic visit and shorten your exposure to the doctor and the doctor's exposure to you.
True. Thank you so much, Bill. And for Dr. Arnold Uswan, is it necessary for us cancer survivors to have COVID-19 vaccine booster, and how many months after receiving the second dose?
Okay. Booster dose have been approved in the US, I think, no, but in the Philippines, it is not yet recommended by the FDA. Okay, we will wait for the DOH recommendation. No, it will come. Practically, this is siguro dahil hindi pa nga tayo lahat na vaccinate sa Pilipinas, kailangan pa ng mataas. So, isi-share muna natin sa iba. So, while waiting for the booster dose, stay healthy, social distancing, avoid crowded places, wear our mask. Again, even if you're vaccinated, hindi po ibig sabihin na hindi tayo COVID. Kasi po yung 'di ba yung IgA daw, yung mucosal lining natin where the COVID will magkikling on, hindi naman affected by the antibody. So pwede po tayo mag-harbor ng COVID virus at mapasa sa ating loved ones. Pero ang maganda sa vaccine, hindi na po malaki chance na hindi tayo magkakaroon ng komplikasyon, hindi tayo ma-hospital, ma-ICU at mamatay. To tell you frankly, another thing pa kasi yung para hindi tayo matakot, ako rin mo po na dito po sa hospital namin, napansin po namin ng mataas na rise nung August ng mortality ng hospital at nakita namin karamihan dito na 80% are COVID. Totoo po to. And out of that 80% na masyado na nagkaroon ng mortality, 85% po niyan hindi na vaccinate yung namatay, 85%. 15% po yung na-vaccinate partial, pero nakita namin yun yung mga may maedad, maraming comorbidities at namatay sa mga komplikasyon ng kanilang sakit, hindi din sa COVID. So malaki po ang mabibigay ng vaccine. Kitang-kita po yan kahit itanong nyo sa lahat ng doktor na yun.
Yeah. And this is the last question. I'm sorry we cannot entertain all questions, but if you have more questions about COVID vaccination, please visit the Facebook page of Cancer Experts, Philippine Society of Medical Oncology. The video that we showed you, katong karon lang, everything. When can you have vaccination while you are having radiation, for those undergoing surgery or about to undergo surgery or chemotherapy or any kind of treatment, everything is there. So we cannot just answer each and every one. But to close, Arnold, if the patient has had hypersensitivity reaction to chemotherapy, such as paclitaxel or docetaxel, or has had allergy to anesthesia, I guess local anesthesia, can she still be vaccinated with anti-COVID-19 vaccine?
Yes. Ang isa po nakita natin dyan is yung pong PEG, what is called polyethylene glycol. Ito po yung parang absorbent kasi kailangan po ng vaccine na ma-dissolve siya para ma-absorb ng body. Ginagamit po to sa mga moisturizer, ewan ko, sa mga ibang gamot. Ito po magagamit sa anesthesia. Sa 3 pong vaccine na meron po nito, ito po yung J&J, yung messenger RNA na Pfizer and BioNTech, no? Moderna. 3 po sila ang merong PEG. Yun po rin yung nakikita natin sa paclitaxel na chemotherapy at yun din po yung mga component na nagkaka-allergy. Hindi po yung mismong messenger RNA. So meron pong mga vaccine na hindi nag-contain ng PEG. Isa po nito yung mga Sinovac, Sinopharm, pero mas maigi, itanong nyo po sa inyong allergologist or immunologist kasi kung meron po niyan, sila po ang makakapagsabi. Pero pag tatanungin nyo, meron pong vaccine na pwede maibigay sa iyo kung may allergy kayo doon.
All right.
Thank you.
So that wraps up our Q&A. And thank you again to our medical oncologist, Dr. Arnold Uson, Dr. Bill Ramos, our dermatologist, Dr. Eve Therese Ramos, and our clinical nutritionist, Dr. Maricel Malazarte, for this very engaging open forum. And God bless you all. Back to you, Erwin.
Thank you so much, Dr. Ellie Mae Villegas, and to our medical experts. And na-inspire ako sa mga topics natin tonight and hope sana po kayo ay na-inspire din po sa mga napag-usapan natin sa gabing ito. And talking about inspiration, I'm pretty sure itong next video may inspire po kayo lalo, especially sa ating mga cancer patients. Laban lang po. Let us all watch this.
Hi, I used to introduce myself as registered nurse, a former flight attendant, and a hotel manager. But after my cancer diagnosis in 2017, I just want to be known as Ron Bernabe Flores, a warrior, a victor, and a breast cancer survivor. I started my cancer journey in February 2017. I don't normally do breast self-examinations, and I guess it was divine intervention when I found the lump on my right breast. So I spent Valentine's Day not on a date with my husband, but at the hospital going through ultrasound, mammogram, fine needle biopsy. I did not receive chocolates or flowers, but I received the news that my lump might be malignant. So after another biopsy, the core needle biopsy, it was finally confirmed that indeed it was invasive ductal carcinoma, or simply put, breast cancer. So like other cancer patients, the first thing that came to my mind was death, considering that I lost a lot of family members to the big C. I lost my mom to ovarian cancer, an aunt to breast cancer, an uncle to lung cancer. Name it, we have it. It's a common household joke that it's not beauty that runs in our blood, it's cancer. So I was 45 years old then, with a good career. All I could think of was the good life ahead of me, growing old with my husband and seeing my 2 kids grow. So I was really scared. I went through phases of bargaining, denial, depression, in no particular order. But it did not last long because God was so good that He surrounded me with people, family, and friends who supported me all throughout my journey. And so I told myself I had to fight the big C head on. I was even devastated when my surgeon told me that my right breast had to go. I could still vividly remember what my husband told me then. Aanhin mo pa ang suso kung patay na ang kabayo. So, that fateful day of March 7, 2017, I underwent modified radical mastectomy. Yes, 1 tower down. And 3 weeks after that, I started chemotherapy. Chemotherapy was one of the worst parts of my cancer journey. It was tough on my physical body, mental, emotional, and even tougher in the pocket. So I spent most of my days not in the office, but at the hospital getting poked by needles here and there, or at my doctor's clinic, and not spending much time with family and friends. So I was aware of the side effects of chemotherapy. I did my homework. I read a lot of breast cancer survivor stories. But you know, it's still different when you see it happening right before your very eyes. I even prepared myself. I cut my hair short because I knew I'd get bald. But a few weeks after my first session, my hair started to fall off and I was hysterical. Losing my hair was really bad, but losing my eyebrows was worse because we know that kilay is life. But you know what? One thing I realized, pilok is lifer. So the rest of the side effects that go with chemotherapy almost drove me to insanity. My nails turned black, I lost my appetite, anything that I eat tasted like metal. I had red itchy patches on my skin due to allergies on my meds. Body malaise was real, and I could barely stand up. It was tiring really, but at the back of my mind, I was telling myself that losing is not an option. So I was ecstatic when I came across ICanServe Foundation because I met a lot of beautiful women who pushed me and cheered me on when I was facing my toughest battle. During those times that I thought I couldn't go on with my treatment. So maybe we were at different phases or stages in our journeys, but I have learned a lot from each and every story. So fast forward to 2020, here I am sharing with you my cancer journey, my story of hope, with a head full of hair and how I wish I could regrow boobs too. So I'm single-breasted, poisoned, scarred, but still standing. So my cancer journey has taught me a lot about life and living. I have learned to slow down on the not so important things in life, but focus on what matters most, like family, friends, spiritual well-being. And it made me realize the importance of keeping my medical appointments, eating healthy, staying fit and living well. So now I'm paying it forward. I am 3.5 years old. I embraced my warrior spirit and turned my pain into my real purpose. I am an active member of ICanServe Foundation because I strongly support and believe in their advocacy on breast cancer awareness and erasing the stigma on breast cancer patients. And we would like to be there too for other women who are going through the same journey, who might need our help through the different projects or activities of ICanServe Foundation. So we would like to use whatever voice we have to encourage women to have their breasts checked. Remember, early detected breast cancer can be cured. Like mine, I'm stage 1. We would like to catch cancer at an early stage where it is highly treatable, or when there are still a lot of options for treatments available. But always bear this in mind. Always go for the scientific evidence-based kind of treatment and no to alternative medicine. So ladies, what I'm trying to say is find time, take the exam, check your boobs because mine tried to kill me. And always remember that early detection is the best protection. Early detection saves lives. Early detection saves a home, the same way it saved mine. Thank you and have a nice day.
When I hear the call, and if you ask me why I am still running, I'll tell you I run for a soul.
Wow, that was truly inspiring, ladies and gentlemen. Maraming salamat po. And of course, bago tayo magtapos sa gabing ito, makakasama po natin ang President ng Rotary Club of Cebu, Fuente, Attorney Bernardino T. Amago IV.
Protocols observed. Good evening to one and all. For many years now, we have been conducting this cancer chat, and it is my belief that just like now, we have alleviated the pains and fears of many when it comes to the big C. I could not thank enough our amazing group of doctors who year in, year out have painstakingly accepted the challenge of having to educate and re-educate our public when it comes to cancer. The Rotary Club of Cebu Fuente and the ICanServe Foundation are truly fortunate to have found breast friends in you. Indeed, there is strength in numbers, and it is in continuing conversation about the struggles and successes of cancer survivors that we are able to build this community that only grows bigger each year. Not that there are more who are beset with cancer, but it is that there are more who now care. So let us not stop this chat. Let us not cease in sharing our thoughts and insights into this fight against cancer. Let us emphasize the fact that it is in awareness that we get to identify the symptoms, thereby detecting cancer early, which in turn can save lives. So thank you everyone for being with us this afternoon, and may we all continue to chat as breast friends. May you all have a peaceful evening.
Thank you very much, Attorney Bernardino Amago IV ng Rotary Club Cebu Fuente. Ayan po ang mga ka-breast friends. Diyan po nagtatapos ang ating masayang gabi sa unang pasabog po ng Pink Chat 2021. Marami pa pong mga activities kayong maaasahan sa buong buwan po ng October. So please follow, like the ICanServe Foundation Facebook page para ma-update po kayo sa mga activities for the whole month of October. Ayan. Maraming salamat po sa lahat po ng bumubuo ng ICanServe Foundation. Ang PSMO, maraming salamat. Daghan kayong salamat and of course for having me again this year. So magkita-kita po tayo sa darating na taon, next year po, for our usual Pink Chat. This has been Erwin. Ang Pingtang Tanan Pirmi, okay? Stay safe, stay healthy. And I've been saying this, let us all heal as one. Ingat po lagi. Love, love, love.
Hello to all Iligans at night.
Thank you, Erwin.
Thank you, Erwin.
Erwin, you rock.